I'm Cindy Moore, and I'm the Dean for the Frank L. Hilton, MD, School of Health Sciences. Jonathan Weinzappel, our Chancellor, could not be here today because of another commitment. He asked me if I would please step in for him, and I'm happy to do so. So welcome everybody to Ivy Tech Community College. We're glad you're here. We've got some tough issues to tackle. I'm very optimistic that we have so many experts today on the panel that's going to be addressing some of these issues. And I think together we will have a good day and a good start to some of these. Jonathan wanted me to mention just a couple of information about our schools and the programs that we have to offer here. Under the School of Health Sciences, I have paramedic science, medical assisting, surgical technology, therapeutic massage, and healthcare specialists. Healthcare specialist has a lot of the little certificates that a lot of you are familiar with, such as phlebotomy, CNA, QMA, outpatient insurance coding. So a lot of our programs here are stackable degrees, or we start out with certificates and end up into a degree. We also have a wonderful School of Nursing. Gail Lindsay is our Dean for the Barbara J. Hilton RN School of Nursing. We work very close together and couldn't do it without her. She's wonderful. I'm not sure. There she is right over there if you want to wave at him, Gail. Some of the things that our students are doing, we do have a lot of opportunity for our students to participate in screenings, health screenings here on campus. Our Wellness and Fitness Center does a wonderful job of coordinating 2 big events each year, one for our employees, faculty, staff, and one for students. And a lot of vendors are invited to participate as well that can provide information about some of these topics that we're going to be hearing about today. Our students are also out there in the community. We're always very happy and to have opportunities for service learning projects that our students can participate in. It's a win-win situation when we can get them out there and give them some hands-on experience with health screenings and patient teaching, meeting others in the community and real patients. So we appreciate working with all the different hospitals that are here, physician practice offices, long-term care facilities as well. So the only other thing I'm going to say is, again, welcome to Ivy Tech. We're glad that you're here. Sometimes we feel like we're just scratching the surface in some of these issues, but it does give me a lot of hope to know that we have so many experts and a lot of people out there that are willing to join together, because I think that is exactly what we need, is together we can make a big dent in some of these issues. Thank you.
Well, good morning to everybody. It's great to see you here this morning. I'm Dan Parod. I am the president of St. Vincent, the Southern Region. And I really want to just say thank you for being here today and taking time on a very important topic. I think the video made very clear that we have a crisis in the state of Indiana around our health. And the good news, if there's any good news in this, is that many of the people who can influence that condition for our community are here in the room today. So I want to thank you for being here. It's very important. And I want to specifically kind of just share a couple thoughts. One is, despite the fact that our country and our community has high quality health care, one of the ironies in our business as healthcare providers is that high quality health care doesn't necessarily translate into high quality health or great health outcomes. And that's a real disparity for us. And if you think about it, and I don't know if you're aware of this, but I might want to remind you that with our country, within the United States, we pride ourselves in having very high quality health care. Yet when we compare ourselves to peer countries, other free world countries with high incomes, we actually are dead last. And so then when we look at the United States, a very startling statistic for us is that the state of Indiana ranks 38th in overall U.S. outcomes. I don't think that that's the Hoosier way. And I think that really is the call to action for us to do something different. And as you can see from the statistics, when you look at specific measures like tobacco use, infant mortality, opioid abuse, and obesity, we come in close to last. And what's another kind of glaring disparity is if you look at the tri-state area and you look at Indiana as a state, if you look at other rankings such as economy, opportunity, financial stability, we rank toward the top in the country. So we lead in those areas, but our health lags. And if you've ever known somebody who's suffering from a health condition, they're going to tell you that health is wealth. If you don't have your health, you really don't have anything. And so it is imperative on us as a state to get behind this and improve this ranking. We see the effects of poor health every day at our health systems, both in our hospitals and in our ambulatory sites. And as healthcare providers, it's our job to make a transition from what we've called a sick care system, when people come to us when they're sick, to a well care system that's more focused on wellness and prevention. And another piece of good news is with all of the change and transformation that's happening in healthcare, our healthcare system is transforming. It is changing, and we are moving, sometimes traumatically, sometimes slower than we need to, but to a well care system where we are more focused on managing chronic diseases, on preventing conditions and keeping people well and healthy. And that's a good piece. Improving health improves the quality of life for the citizens of our state and our community, and it improves the economic vitality of our region. So we've worked together, St. Mary's, St. Vincent, with Deaconess, other community partners for many years on a community needs assessment process to look at, for our counties in this area, what are the greatest health needs. And we've worked together to identify those needs, to prioritize those needs, and develop plans to address those. In 2016, the last assessment, we're getting ready to complete an updated assessment this year. In 2016, there were 3 priorities that came out of our community needs assessment: behavioral health, maternal, fetal, infant, and child health, and then exercise, nutrition, and weight. You wouldn't be surprised to hear those 3 priorities based on our rankings. And what I would tell you is that much work has been done in this community by many people in this room to improve those conditions. And I was asked to sort of give a list of many of the things that we have done, but I'm going to skip that today because you're going to hear about that really throughout the morning. But I think the key driver here is that while much good work has been done, there is much more work to do. And we are not where we need to be. And that is really, I think, the rallying cry for us today. And the reason for this town hall is to look at where are we at, but where do we need to be, and what is it going to take for us as a community to come together to organize to improve those conditions. We are really proud to support the Alliance. The Alliance was created to tackle the most pressing public health issues in our state: tobacco use, obesity, infant mortality, opioid use, and we fully support those goals. As a non-for-profit organization, our job is to care for those in this community, to provide the highest levels of care, and to specifically focus on the poor and vulnerable, and we're proud to do that. One of the things I would share with you as being in Evansville community for 2 years, and I've been very proud and vocal to share, this is a wonderful community, and there are so many great things happening here. I really believe that Evansville and the tri-state area is on a roll in so many ways, but I think this is one of the areas that potentially holds us back. I don't think it's the Hoosier way, and I know it's not the Evansville tri-state way. This community comes together to address things, to improve the conditions for our community, and to advance our state and our region. And so I would call you to really focus in today on what are the calls to action that we need to take to follow up, so that when we come back together, we can be celebrating some great accomplishments. There is a popular home improvement store in the area that has a slogan, and the slogan is really simple. It's "Let's do it." Heard that slogan before, and I really think that slogan fits the call that we need to respond to in terms of improving health. Let's do it. I'm really proud that 2 people who follow me are people who get up every single day and work hard to improve the condition of this community, and we are so blessed to have great community leaders. And so Dr. Ken Spear with our health department, and we have got a wonderful mayor in Mayor Lloyd Winnecke. And can we give them both a round of applause for their leadership? They do a great job. So. And with that, I'm going to introduce the mayor.
Good morning. Wasn't enough caffeine out there, I guess. To all of our out-of-town guests, welcome to the city of Evansville. You should know that it is very common on August 1st at 8 a.m. for the temperature to be 69 degrees, with a relative humidity of about 40%. So tell all your friends and neighbors around the state they need to come here. I was thinking about what to say today, and I thought about this. If you filled this room with mayors from around the United States and you gave them truth serum and you asked them what bugs you the most about being mayor, I suspect one of the top 5 answers you might get is rankings. Because frequently, rankings come out from all kinds of sources. Some are really credible, many are not. So in 2011, I had this wild idea to run for mayor. And about that time, a poll came out, a ranking that showed Evansville was the most obese city in the country. Not a mantra that any community wants. It was really eye-opening. While many of us may have known that intuitively, maybe not as the most obese in the country, it was really eye-opening. So we tried to do a little something about it. So when we came into office on the 3rd, we created this program called Energize Evansville. On the 3rd Saturday of every month, we lead a community exercise program. And the whole idea is to make people more cognizant of their health, encourage them to be active in the community, to exercise. We encourage scout troops to come out, church groups, neighborhood groups, families. We have a little bit of everybody. We've partnered with almost every organization in the community. We've partnered with the Deaconess Healthier You Walks. We've done events at Tri-State Racquet Club. You name it, and we've been there. We've done pickleball. We've done hip-hop line dancing. We've done regular line dancing. We've done water aerobics in the winter and in the summer. Some months we might have a dozen participants. Some months we might have 100. But we can do more, and we need to do more. Initially, that program generated a lot of media coverage, but I don't think they realized we'd continue to do it. So on the 3rd Saturday of every month, at 9 a.m., we're out doing it. Last month, we were at Lorraine Pool doing water aerobics. This month, we'll be at Wesseman Park doing a walk and having doctors there to talk to about what ails you. That's one small thing the city of Evansville is doing. For those of you who live in the city, we encourage you to get out with us on the 3rd Saturday of every month. It can't be the 1st Saturday, because we're picking up trash then. But it's one thing that we can do to help energize our community. So the other thing that, rolling back to when we first came into office, that was really disheartening was that Evansville and Vanderburgh County always led the state in the number of meth labs. Again, not something you want to be a leader in, but it was not unusual for the city of Evansville and Vanderburgh County to have well over 100 meth labs in a year. And frequently that number would rise to 120 or 130 in a year. So I asked Dr. Bill Wooten to help me. We formed the Mayor's No Meth Task Force. And we had a single mission, and that is to help reduce the number of meth labs in the city. And we used all kinds of awareness tools. We had televised town halls. We went out into the community. We spoke to neighborhood associations. We engaged the community. And eventually that tide began to turn. We no longer lead the state in that category. We now have about 40 or 50 in a year versus 110 or 120. So we're making progress there. As that began to change and opioids really started to take hold in our community and others around the state, we changed the focus of the Mayor's No Meth Task Force. We wanted it to be more nimble, ready to respond to emerging trends. So we called it the mayor's substance abuse task force. We expanded the group, developed a really robust website. The idea, again, is to be a resource for the community. We're exploring a number of possibilities in the state. Just recently, Dr. Wooten and I toured the Warm Center in Henderson, which is a phenomenal regional treatment center for women. We'd love to be able to replicate something like that in the state of Indiana. We took the lieutenant governor there. She was really impressed. And there are talks underway about what that might look like if we were able to do something like that in Indiana. We raised our hand and said, we'd love to be a pilot. That's going on. The Mayor's Substance Abuse Task Force is also exploring the possibility of having FAST teams or fast action support teams ready to respond to families in crisis when their loved ones are experiencing an overdose or some sort of crisis because of drug abuse. Coincidentally, a number of us are meeting in the mayor's office this afternoon. The leadership from the two healthcare systems in the city are meeting to talk about that very issue. So there's a lot going on. But as Dan said, a lot more can be done because these statistics, the numbers that no mayor would like to see a part of their city, related to their city, and certainly no governor or state administration or state legislator would like to see that and be proud. We can do better. We need to buckle down and do more. Our administration is willing to do that, and I know everyone in this room is willing to do so too. Thanks for being here today to have discussions that might be a little uncomfortable, but certainly required for any city, but certainly a city like Evansville that's trying to be bigger and better. Thanks for being here today.
Good morning. Good morning. I'm Dr. Ken Spear, Vanderburgh County Health Officer. And I took this job about 4.5 years ago, and I thought it was going to be a nice, easy, slow down job. And it's been anything but that. It's been extremely, it's been a lot of work, but it's also been a lot of fun, and I've got to meet a lot of really nice people. One of the first things we did when I joined was we changed our logo to be more modern, but also to represent the 3 Ps of public health: prevent, promote, protect. And then I added partner because I thought, without partnerships, none of this work that we're trying to do can be done. There's no single entity that can go after fetal infant mortality, opioid abuse, obesity, smoking, etc. And I just wanted to point out some of the things that we are doing at the health department to try to address some of these issues. We do have a very significant program, smoking cessation program, along with a way down program, and those are very well subscribed to. They were just telling me last night that all of the evening classes are filling up now, and we have 3 people going out to the various industries in the community, taking these programs out to the communities, but also bringing the community into the health department to work on these programs. We've also joined the Mayor's Substance Abuse Task Force, and along with IU School of Public Health, have been pilot for the opioid fatality review. And what we're trying to do is look at commonalities within those reviews and see if we can better predict ways to avoid or to prevent, number 1, addiction, and number 2, the overdoses. That's been the ongoing process and will continue. We also had Baby Me Tobacco Free, which is a really nice program in that if mothers come in and quit smoking, they get free diapers every month for the first year after the baby's born, if they can prove they're not smoking. And if their husband agrees to quit smoking also and comes in with the mother, they can get vouchers for free diapers for about $50 value each month. And I think so far we've had 355 people through the program, and it's been extremely effective. In our normal birth weight is at 8.2% for that program, and healthy 2020 is 8%, so we're already getting close to the goal. And then we were extremely lucky to obtain a grant from ISDH called the Safety Pin Grant this last time go around, and initiated a program that we term Pre to 3. And this is a home visitation program, and it's a mixture of a program. It's got community health workers along with nursing staff that supports the community health worker, and also a nurse practitioner who will be at the Evansville Christian Life Center that we're helping support. And the program is interesting in that anyone is eligible. If you're a new mother or you're going to be a new mother and you don't have any support, there's no income criteria, etc. But what you end up with is a visit once a week by a community health worker, and then oversight by nurses either once a month, or they will come into the home if there's a problem such as diabetes, hypertension, or the baby's not doing well, failure to thrive. And it's got an evidence-based program called Growing Great Kids. And we're already seeing data. This program has been going 3 months. And we just got the survey back from the people that are involved in the program. And they're more confident, they're better able to handle stress, and they're less willing to take other issues. We also have a new partner in this program, the Black Nurses of Evansville. And I think Orlando's here today, and they're going to actually extend our reach on this program, Pre to 3. And I think really to address some of these problems that we're talking about today, these are generational problems, and I think we need to start at the very front and get these children safely matriculating through infancy, childhood, and the educational system. And then a generation from now, hopefully a lot of these problems will tend to disappear. So again, thank you for allowing me to speak. Thank you for all coming here, and hope you have a very good day. Thank you.